I am Amika, co-founder of Nourish Doc, a platform for natural and holistic therapies. Our network of experts offer wellness programs that are backed by research, science, and success outcomes. We bring a new topic every Friday at noon Pacific Standard Time to educate our viewers about efficacy of natural medicine. Today, we are going to talk about how acupuncture can help alleviate side effects of chemotherapy. We have Dr. Gene Healy, who is a licensed acupuncturist physician from Florida. He has a master's in Oriental medicine, as well as he is an expert on yoga and meditation. Dr. Healy is also a member of Florida Cancer Specialist and Research Institute and helped thousands of cancer survivors to help alleviate the side effects. Welcome, Dr. Healy.
Oh, hello. Thank you for having me. I'm excited to be here.
Thank you. So I'll ask a few questions for our viewers, and if you can please help answer. So first of all, we want to understand what are the different issues that cancer survivors have when they go through chemotherapy?
Oh, that's a very big question. You're putting some of them up on the PowerPoint right now. I can see, of course, they can have various kinds of pain, fatigue, nausea, and vomiting. All of these things that you're listing on the PowerPoint are true. I can tell you a little bit about specifically the kinds of things that we treat the most, that patients seem to see us for the most. One of our specialties is actually chemo-induced neuropathy. We have a research study with the University of South Florida, which is here in Tampa, and also Florida Cancer Specialists. We partnered with them on the efficacy of acupuncture and chemo-induced neuropathy. It was a very positive study. We have very good results. Our success rates are very, very high. And this is a condition that most people have no treatment for. They just give you gabapentin, things like that, and they're not very effective at all. But that's something that people actually refer to us quite a bit about. Of course, other common things that people do see in cancer care, they come for things like nausea, of course, they get that from chemotherapy, but they're getting better these days with anti-nausea medication, so a little bit less of that. Fatigue is a very common one. Hot flashes, also a common one, especially with things like breast cancer when they're on estrogen suppressants. Other patients, most oncologists will be happy to refer for acupuncture, but they're not really so excited for things like Chinese herbs, which could actually be much better at conditions like hot flashes. We have a couple oncologists that give us some leeway so we can do Chinese herbs for some of these conditions. But every condition here that I'm looking at on this slide is something that we've treated. We treat it often. I'm not going to keep going on and on because I'll take the whole time just talking about this slide.
Sure. So please tell us, how does acupuncture work?
Well, acupuncture, we like to talk about it in different ways. Sometimes I like to use a biomedical explanation. I'll give you a simple one. If we talk in kind of in esoteric, quasi-spiritual terms, it often turns people off in America. Even though it is definitely thought of like this in Asia, they would think of it like this in South Korea, where I spent a lot of time. But in America, when you start to say chi or energy, people don't really understand it, and you can see that it's actually creating some distance between the practitioner and the patient. So some people actually will like it, but those patients are often more into, and they will think about energy healing or energy work, but then they don't understand the medical necessity of repetition and going through a course of treatment. So you equally have problems with those patients too. But I would say that acupuncture specifically, what it does is we can talk about it as far as helping increasing blood flow to a particular area. As it does that, it can also increase organ function, increase nerve conduction, increase white cell count in the area, upregulating the immune system, releases endorphins. It helps with overall homeostasis in the body, which affects things like hormone production and the rest. So it can have a very global and also a very specific effect. Chinese herbs, on the other hand, they do add something very substantive to the body, so they can change chemical composition, and there can be a tremendous amount of benefit with Chinese herbs that people don't know about. People know the word acupuncture, not so much Chinese herbs. But when you look at substantive deficiencies or even excesses in the body, for example, like low hormone levels, acupuncture can balance hormones, but it's not really going to increase your hormone levels. But things like herbal medicine actually will.
That's very informative. I think you mentioned a little bit about the research earlier, and you're part of the cancer program. The Research Institute as well. So maybe you could explain the theory behind, how acupuncture is specifically useful in the cancer therapy and the side effects that we talked about.
Okay, so let's talk any particular side effect. I'm going to start with neuropathy, and because I can kind of rattle on a long time, I don't want to eat up all your time. If you want to talk about a different symptom, why don't you just say, hey, let's talk about a different one now. So specifically for neuropathy, what happens is chemo-induced neuropathy means basically they're getting toxicity from the chemotherapy and they're actually receiving nerve damage. Most of the time it's going to be very distal in the feet and the hands, and the worse the nerve damage, it'll start to go up the leg and up the arms. The worst I've seen it is patients literally whole arms, whole legs with no feeling. So this is physically nerve damage. And what happens is when they're off the chemo, a certain percentage of people will improve to a certain degree on their own because the body heals, but some people will not improve ever. They have permanent nerve damage. And what we've seen is when you do acupuncture, honestly, it's not that complicated. You just do a lot of needles all around the arms and leg, every channel, every area that is basically damaged. And if you have access to other kinds of modalities, for example, electroacupuncture is very useful. We also do prolotherapy, which is an herbal injection therapy that we do, very useful. We'll do other modalities, infrared therapy, herbs, things like herbal foot baths, all kinds of things. But when you put it together in a treatment plan, what happens is, especially with the proper frequency, because these patients need to be seen at least 2 or 3 times a week. A once-a-week process is very, very slow, and oftentimes there's frustrations and patients do not get the outcome that they want. So what is happening is that you're increasing nerve conduction. Specifically, this is nerve damage. So you're increasing blood flow to heal nerve tissue, increasing nerve conduction, and nerves regenerate. So feeling starts to come back, and the experience is often more distal. What that means is if they have it all the way to the knee, it starts to have sensation up there around the knee, and then it starts to feel better, and it goes down the leg, and then the bottoms and the very toes of the feet will be the last to respond. And oftentimes, like if you were to say, what's the prognosis? You get it, let's say it's all the way up to the knees, because oftentimes it's most common in the legs. Then 50% prognosis would be within the first month at a 3 times a week dosage. And then twice a week would get it to about 75, 80%. And then you start to taper down like once a week. And then we talk monthly schedules. Then every 2 weeks, and then once in 30 days. I like to talk about what's called a 30-day hold time, where symptomology is stable or gone for 30 days. So we know it's not going to return. So that's a general prognosis of restoring and healing function with neuropathy. If you look at things like for example, poor appetite or nausea, the issue with that is when people get chemo, oftentimes what happens is it's a very hard day when you get chemo, but the nausea doesn't actually take effect till the next day. The reason for that is chemo attacks fast-growing cells. Cancer is very, very fast-growing cells. So also the stomach lining is it's an area of a lot of fast-growing cells. So those die off and you experience nausea. So what you do is you schedule the patients to come in the day after chemo. Sometimes it's hard, they don't have much energy and they don't want to leave the house. But if they can get there, you can do a tremendous amount to help with their fatigue. Some people actually get it 2 days after chemo, the fatigue and the nausea, and you time it accordingly. And they're just going to get that every time they get chemo anyway. So they're going to need that every time they get chemo. And also you can use it to boost the immune system and to also boost the stomach's capability to rest and digest. So you can use it in a supportive fashion. Until you stop me, I'm just going to continue to talk about conditions, okay?
Please continue. I think this is very useful information for our viewers.
Okay, good. Let's take, for example, hot flashes. Hot flashes are because literally they're on estrogen suppressants, for example, in women, or for men, they could be on testosterone suppressants if they have prostate cancer. So acupuncture, you can say it's kind of like a system of organization and balance where you're using the body's resources more evenly. So acupuncture can help for hot flashes and things like low testosterone levels just by kind of putting resources where they should be. But at the same time, it's not going to add more to those levels. So those patients, for example, on estrogen suppressants or testosterone suppressants, their doctors do not want them with higher levels because their cancers are being fed by those higher levels of hormones. So they want those low. But for herbal medicine, there is a lot of safety. There's a couple herbs you have to kind of consider and you want to remove when you make a formula because they have some possible controversial evidence when it comes to estrogen mimicking properties. But it's really not many, and the safety margin is very, very safe. So there's a tremendous, plus they monitor, you can monitor, if the doctors don't, we do anyway, you can monitor hormone levels. And when that's done, you can make sure that they're in a safe range. And what happens is their symptoms abate with Chinese herbal medicine much, much faster, much, much more thorough, which makes things a lot more comfortable because once they're having these terrible hot flashes and night sweats, oh my God, women, you know, they can't function, they can't sleep, very irritable. I see that smile on your face. It might have been something that you're familiar with personally, I don't know. So these are terrible things that people have to suffer through without any kind of treatment for them.
Sure.
There are many. Please
go ahead. Please.
No, because we're on a Zoom and I actually can't see my face and you're in a tiny window, I can't really respond to you, so I'm just rattling off.
No. I was just going to ask you on a further question, continuing question is that I think this is very good. You know, you've done so much work, but also you could also talk about, since you're involved with the Research Institute, Cancer Research Institute, you could also talk a little bit about the research and any clinical studies of all the symptoms that you're talking about. I think that would be very good as well.
Well, there's a tremendous amount of studies when it comes to cancer and acupuncture at this point. When it comes to herbs, almost none. All the studies are in China and they're in Chinese. Herbs are going to be very complicated because Chinese never really prescribe one herb. It's not like you have a hot flash and they give you only black cohosh like we would think about it in Western herbology. That's very, very ineffective. We would always do a formula, and therefore it's very difficult to measure the benefits and all the interactions in multiple herbs. So it becomes a hard study to do. With acupuncture, there's just, honestly, there's thousands of them at this point. You can just really put in PubMed, acupuncture with anything, acupuncture, chemo, nausea, you can put neuropathy, acupuncture, and you're just going to see scores and scores of studies. It's very, very well researched at this point. There are complications with the research of acupuncture because one of the complications, there's several complications. One is they tried to do these studies with what's called sham acupuncture. That means there are two different kinds. One, you would take like a fake needle. If you touched it into the body, the needle would actually not go in the body. Two, they might poke an acupuncture needle in a different part of the body than where the actual point is. But what they found out that an acupuncture needle anywhere in the body, because it actually is a foreign substance, right? The body mobilizes an immune response. So you can have a beneficial effect from literally acupuncture anywhere. So then when you're saying what is more effective, if I just put one randomly, or if I put one in stomach 36, which helps the stomach, then it becomes a little bit more complicated. Plus, at the same time, practitioners, what they do is there's a lot of, I guess, license and artistry when it comes to acupuncture, and practitioners practice very, very differently. If you look at China and traditional Chinese medicine, they might go under standard like point prescriptions. Let's say, for example, you have nausea and they're doing stomach 36, spleen 9, and there's kind of like a standard understood kind of pattern that most practitioners will use. But most practitioners in the States or in other Asian countries like Korea, there's a lot of freedom because there are many roads that lead to Rome. All we have to do is get the right effect, and there's a tremendous amount of discrepancy between practitioners. Some practitioners are masters, some practitioners are honestly just beginning their practice. So I've been doing it and I've seen probably, 50,000 plus patients. It's a very different experience when you go into somebody who's seen 100 as opposed to 50,000, even if they're using the exact same points. So there's a lot of variance, and it's complicated when you look at the research. But what you do see in the research overall is a tremendous amount of studies that are positive, a lot of studies that are unclear, saying we don't know, we're not quite sure. And a lot of the reason is because they don't understand the mechanism. So Western practitioners, I think that it would benefit us if when we speak to MDs, we just spoke MD language, we just use biomedical language and stop using even the word chi. It just doesn't really serve us. So to kind of talk a little bit deeper about it, so I don't know your background very well, but I can see that you're an Indian woman, so you must have some background in Indian philosophy and Ayurvedic medicine. So let's say I'm not an Ayurvedic practitioner, but I know a bit about it, and I know quite a bit about Indian philosophy and culture. So if you were to give an Ayurvedic prescription, an herbal prescription for something, and the patient had a cough, right? And you start to identify a patient's particular constitutional type, and you give herbs that help with a particular condition, there's also still the added resonance and depth to look at a spiritual consequence of that medication. But most practitioners and most patients are not really going to get to that spiritual level of resonance because they're just coming in with a symptom like I have a cough, I need help with this cough. And most of the time, it's a different explanation. It's not really some deep spiritual conundrum, the reason for my cough. Sometimes it could be, but most of the time it's something very medical, very biomedical and physical that you can describe. And we try to use this language because we find it much more productive when we talk to patients and when we talk to doctors.
Okay, got it. So, no, I think this is very informational. I mean, I have personally used acupuncture I had a frozen shoulder, so I can vouch for acupuncture because I couldn't even lift my arm. And after about 10 sessions, and I'm like a new person, I can do everything. So continuation of that thought process, I think it would help, success stories users can always resonate. So maybe you could talk, I know you've treated so many patients, but one of your success stories that what the user felt and what did you do? So that would be good.
So this is Bobby. I haven't actually looked at this this testimonial in a long time. So Bob, I remember very well. He had a lung problems because he had lung cancer. So he had a difficult time breathing, and he's very skeptical because most people think it's very foreign. So Dr. Jum has mentioned here in this testimonial, he is one of the, I would say, champions of alternative, or we'll say complementary medicine here at Florida Cancer Specialists. So I really don't think in the state of Florida, we're not super progressive when it comes to complementary care with cancer. So there are very, very few cancer hospitals that actually have an acupuncturist on site. And we're one of them, and we've been there for about 7 years now, so we're proud of that fact. But he had a difficult time breathing, and he had pain. Of course, first he came to see me for pain, and pain improved, but he had a breathing issue, and he was rushed to the hospital, and we started to work with him. And of course, we did acupuncture, and we did some moxibustion. I had to see him outside of the clinic because I'm not going to take moxibustion to a cancer hospital where people are on oxygen and introduce fire. So I didn't do that. And he improved quite well. We wanted to do herbs with him, but he's a skeptical, nervous type, so he didn't want to do herbs because of the chemo that he was getting, but he still had a very good response. So Bobby, we honestly saved his life because he could have died. He could have asphyxiated. And we gave him some home care to take home. For those of you who don't know what moxa is, we haven't really talked about that. If you go to Asia, acupuncture, when you study acupuncture and moxa together. It almost should be called acumoxa. And oftentimes, specifically like in China, they'll study only one discipline. For example, they'll do their medical training, but then they'll do acupuncture and moxibustion. And herbalists will be separate. And then, for example, like Tui Na, which is manipulation and adjustment, will be separate. And these are all separate courses of treatment and care and learning. In Korea, they'll learn them all together in a long course of care. But there's what's called manual therapy, like acupuncture, moxibustion. And then you start to do things like internal medicine with things like herbal medicine, dietary therapy. Tui Na or Chuna in Korean is manipulation. That's also considered manual therapy. But moxibustion is mugwort. In Korean, it's called suk. It's called tum. And it's the process of burning mugwort, either in many ways, close to the body, on a needle, to provide some heat therapy and actually some energetic therapy to the person.
I've tried it actually. The acupuncturist I went to in California, when I had my frozen shoulder, I was so scared, I remember, and I'm trying to understand, and then I had to read up on moxibustion, and she explained me how it works together with the needles and the heat therapy. So I think it was very, very effective on me as my frozen shoulder. You've also, I know I watch your meditation sessions, they're very therapeutic on your Facebook page. So I was wondering if, would it be okay if you do like a 1 minute or teach our viewers how to do a simple meditation?
Sure, I'm happy to. Oftentimes when I have new students, I just do kind of a mindfulness practice. Oftentimes when people meditate, they say, I'm terrible at it, or I don't know what I'm doing, or I can't keep my mind clear. And many of the reasons for that is they were never given any technique, some homework, something to do with your mind. There's very few people that you can actually say, okay, let's go meditate, go here and just breathe. It's not very effective. People's minds are jumping all over the place and there just becomes tremendous frustration. So I like to walk people through a mindfulness practice, and we can do that quickly now. So when you're seated, a triangular posture is useful. If you need to sit on a chair, perfectly fine. Or you could actually do it lying down or standing, but seated is often better just so you're a little bit more stable in the beginning. And as you are sitting there, I like the eyes a little bit open, half open, quarter open, looking about 45 degrees at the ground. The reason for that is when you close your eyes, it's easier to fantasize for a beginner. Not to say that you can't close your eyes in meditation as you progress. So when you have the physical experience of breathing in and out, you just breathe in and out through your nose. You're going to physically experience what does it feel like to breathe. What is the sensation of your body as breath enters the tip of your nose, the rising of the chest as breath enters in the lower abdomen, and the sensation of exhaling and the falling of the chest and lower abdomen and the air leaving your nose. So as you breathe in and out, we're going to give your mind some homework, an anchor, something to do. Very lightly with your mind, as you breathe in, you're going to label that experience rising. Rising is rising of the chest and lower abdomen. And as you exhale, you're going to label that experience falling. Falling is falling of the chest and lower abdomen. So the base practice is just breathing in and out with the physical experience of breathing and just labeling it rising and falling. We'll give you one extra piece of homework for those who want to take this technique and continue it. As you're doing this, when you sit for any length of time, be it 5, 10, 20 minutes, 1 hour, rest of your life, your mind is going to wander hundreds of thousands of millions of times. So when that happens, you drop the rising and falling, and you take a second to notice that your mind is drifting. And what you do is you label the thinking of the mind, you just label it thinking. Don't worry about the thinking content. Don't try to suppress it. Don't try to go along with it and fantasize with it. Just lightly label it thinking 3 times with the mind's eye. Thinking, thinking, thinking. Then return to the process of rising and falling. So that's a base anchor practice that you can use. Basically breathing with rising and falling and labeling it thinking when thoughts start to arise and then going back to rising and falling. I hope that was useful for somebody.
I think so. I think this is very useful. We are keeping these Friday sessions very short and crisp. I hope our viewers found this useful. Please give us feedback. You can reach us at nourishtalk.com. Dr. Healy is available for consultations to any cancer survivors who would like to know a little bit more about how acupuncture and herbal medicine can help them alleviate their side effects. Anything else you would like to say, Dr. Healy, before we close?
I would like to say that people really should explore their options. They really don't know what is available out there, and I think that we should put a little attention to root causes. Not just cancer, but even if we talk about cancer, we don't think about why a person got cancer. We just try to kill it. And I think if we support the body's ability to not get cancer again, that's a tremendous thing to do for somebody. And we should all question and ask each other and ask ourselves, are we addressing the root causes of our illness with this therapy? And if not, how can I find someone who will?
That's very, very thoughtful. That's very good. That's very good. Dr. Healy will be back with us. We'll bring new topics every Friday, and please let us know what are the topics you would like to see us bring on every Friday. And I want to thank Dr. Healy for your valuable time and talking to us. Thank you so much, Dr. Healy, for being here, and look forward to talking to you again soon.
All right, thank you.